My name is Kristi Guinn. I'm a project manager here at Seattle BioMed. I have one son, he's 3 years old. My primary focus is on a large drug discovery consortium. We are looking for new methods to apply to drug discoveries for tuberculosis, which is a disease that has largely been ignored by the pharmaceutical industry and for which the need for new drugs is extremely urgent. Tuberculosis has an effect on families in many ways. TB is a disease that affects all kinds of people, all ages, male and female, kids and adults. One particular story that sticks with me was printed in the New York Times a couple of years ago, and I think about it remarkably often in the 2 years since I've read that. There are hospitals, particularly in South Africa, where the epidemic is very strong, that are specifically for patients that have TB. And there are some hospitals that are specifically for strains that are extensively resistant to the drugs that we have. So these patients are very sick and we don't have good treatments for them. And the pictures of the hospitals actually look more like prisons. There are multiple rows of chain link fence topped by razor wire. There are guards that stand at the entrances, and the patients try to break out. And this happens oftentimes around holidays. And there was a story of one mother in particular that had broken out around the winter holidays to go home to her husband and her 3 kids. And my first reaction kind of logically is, what are you thinking? You're going home and you're exposing your family to this disease, which is deadly, because TB is a disease that is airborne, is passed when people cough or to speak or sneeze. But then she went on to talk about how her sons were growing up without her and how that felt for her. She'd been in the hospital for an entire year and hadn't seen her family. And as a mom, I totally get that. Like that drive to need to be with your family, and for that to be taken away from you because you've gotten a disease. It's not like, another patient commented, we're being treated like prisoners, but we haven't done anything wrong. They didn't do anything. They breathed in the wrong place and they breathed in this bacteria that made them very sick. So to protect the public, they were being kept in this hospital, but at the same time, it's robbing them, of their freedom and to be with their families. So we desperately need new treatments to help the people that are being affected by tuberculosis. The donations will be used directly to support research that goes on here at Seattle BioMed, like looking for new drugs to fight tuberculosis. Everybody can play a role in global health if they choose to take on that role, and then this is a way that anybody could play a part.